Me and my wife set up our practice here, and we found that there was a lot of energy in the community about a project called PATH. So we said we are always looking for how can we do better than what we did yesterday. And being internal medicine specialist, you see people with multiple diseases. This got us very interested in exploring what PATH has to offer, and we always wanted to contribute back to the community, and that is how we got involved with PATH.
I was at a conference last year where we were talking about the use of social media in communicating with patients. And social media, the way we know it nowadays, most of the time it's an insecure platform. And so I was looking for a platform that was secure and consistent, allows bi-directional communication with my patients over time, in real time. So the PATH had that technology, and I think it was, from my point of view, exactly what I was looking for.
We see people with a weak heart, they have fluid buildup, and we often say to them, you know, this is a chronic condition, you're going to live with this. The question is how well you're going to live with this depends on how well we can monitor you and how well you can monitor them. You can monitor yourself. Where the PATH tool comes in is how well the patient can monitor themselves. Here it involves how they go through their life on a day-to-day basis and how it affects them. Their diaries, their belief systems, their actual data as it changes. When they go out to dinner, do they gain weight? Do they lose weight? Do they have to increase their water pill? So that is how we see, or I see, the PATH tools being used quite effectively and seamlessly and enhance care rather than just being another data point. So this is very fresh in my mind because it happened right in this room, and 2 days ago, an elderly couple walked in. They were here for a follow-up of their aortic stenosis, which is when their aortic valve right here does not open well. So the classic symptoms would be shortness of breath, swelling in their feet, and their other problem was Parkinson's disease. They were well versed about their disease. They were well versed with the symptoms. But when they walked in, they announced, I'm a PATH patient, and I'm told you would like to see this device. And they handed me a smartphone. And as I went through, and I'm looking through the list of what they are going through, their symptoms were that of blurred vision, constipation, fatigue. I cannot finish a book. I feel tired, and I'm so frustrated because of all of these symptoms that I don't know what to do. So think about it, that they came in for a valve problem in the heart and a neurological problem of Parkinson's disease. None of these symptoms are directly related to that. So I could have treated their disease and said, you don't need to do anything, you're cruising, you are on the right medications and things are well. But I would not have eliminated their suffering. I could literally see the wife and the husband light up because they felt like somebody had really heard what they suffered from, not just address the disease or diagnosis that they had.
If you picture yourself as a patient and you have a skin lesion, for example, or you have a test result that you want to know what should be done with, instead of picking up the phone and having to deal with the clerk who always will tell you, almost always will tell you the physician is not available and you need to book an appointment, and then you're worrying all until your appointment comes, and then basically you're going to hear, well, that's normal. Versus the other option where you say, well, Dr. So-and-so, I did my blood work and these are and I know the results are such and such. What do you think I should be doing? And the answer would be, well, based on these, and your physician knows you very well, this is the plan. Communicate a concern and get an answer in a way that avoids everybody the cost of traveling, the time that's involved, and the patient can also get answers faster. So I think we'll be more efficient in delivering the service. The patient will incur less cost in getting the answer.
If the patient is engaged and they are doing self-monitoring, or what we call the activated patient, they will have better outcomes. We have seen in the literature that people, if they're provided education about their lung disease or heart disease, or when to seek the help or opinions of their healthcare provider, they better utilize the system and they're not rushing to the emergency room and driving up care. This has been proven again and again. In general, improvement of a healthcare system, in my opinion, in the future would be defined if we can decrease suffering in addition to treating the diseases.